Hey everyone, in this presentation we are going to be going over Diltiazem as well as watching a quick video on the administration of it. Diltiazem, which is also known as cardizem, is a calcium channel blocker that slows the conduction through the AV node, increasing refractoriness in the AV node. It produces coronary and peripheral vasodilations. Its indications are going to be AFib with RVR, aflutter with RVR, and multifocal atrial tachycardia. This can also be given in paroxysmal supraventricular tachycardia that is refractory regardless of adenosine. Its contraindications are going to be sick sinus syndrome, which is a second or third degree AV block without a functioning pacemaker, hypotension, which is defined as less than 90 millimeters of mercury systolic blood pressure, cardiogenic shock, hypersensitivity, Wolff-Parkinson-White, ventricular tachycardia, wide complex tachycardia of an unknown origin, acute myocardial infarction in patients receiving IV beta blockers. Side effects include nausea, vomiting, hypotension, first and second degree AV block, bradycardia, CHF, ventricular dysrhythmias, diaphoresis, syncope, and headache. This medication should be given slow. We do not fast push this medication. It is a very, very slow push. So here we see the adult tachycardia narrow complex guideline. Notice that once you get down to Diltiazem, the dosage is 20 milligrams IVIO. You can repeat this dosage in 5 minutes if the systolic blood pressure is equal to or greater than 100. The dosage for the repeat dose would be 20 milligrams. However, if the patient is age 65 or older, we are going to cut the dosage in half to 10 milligrams. And whenever you would repeat that dose, you would repeat it at a dose of 10 milligrams as long as the systolic blood pressure is equal to or greater than 100. So to put an emphasis, whenever you see may repeat 20 milligrams in 5 minutes if systolic blood pressure is equal to or greater than 100, we are speaking of the dosage that you gave them. So if they are equal to or greater than 65 and you gave 10 milligrams, that would be your repeat dose. Your repeat dose would not be 20 milligrams. Going over the dosage one more time is going to be 20 milligrams IVIO for patients that are less than 65 years of age. If they are greater than 65 years of age, you would give 10 milligrams IVIO, and whichever dosage you used, you are permitted to repeat in 5 minutes if the systolic blood pressure is greater than 100. Hey everyone, what's up? This is Kenneth James with Southwestern Illinois EMS System. So we're going to go over some Diltiazem here. So what I have here is my Advantage bag. I have my Diltiazem 100 milligrams and I have my syringe. So follow me over here. Take my bag. Want to pull out the stopper here. So if you'll notice, that's completely gone. I got my Diltiazem, and it's going to go in a round manner. Now we have that. Notice that the gray little plug there. So we're going to connect these two until they feel nice and secure in there. So it can take quite a bit. Once you get it in there, notice you're going to kind of take that plug and you're going to get it out. So the plug is now in the saline. You're going to mix, and it's kind of like your glucagon. You're just mixing it up, inverting it back up. And after you're done, you're going to kind of look in there. If you'll notice, I don't have any more powder substance, so we're now good to go. So if I have 100 milligrams and 50 milliliters, I'm going to have 50 milligrams or 2 milligrams per milliliter. Our protocol says give a 20 milligram IV push. So obviously we're not going to utilize this. We're going to draw up 10 milliliters of our fluid, which has Diltiazem in it. That's going to give us 10 milligrams or 20 milligrams. Sorry, I didn't put air. Ain't no good. All right, so now we're at 10 milliliters at 2 milligrams per milliliter. That's going to be 20. Keep in mind, if you had a patient who is over the age of 65, they're going to get half that dosage. So that would be 5 milliliters, and that would be 10 milligrams of diltiazem. And you can repeat that dosage one time per the guidelines. So study your guidelines. That's basically how we do diltiazem. This is not going to be used as a drip form. And we appreciate you watching this video. Stay safe. Enjoy those guidelines, clinicians. All right, so something to keep in mind there is that it's going to be a slow push. Diltiazem is not a fast push drug. Nice and slow. You don't want to bottom them out. You can drop that blood pressure pretty quickly. If you have any questions, feel free to reach out to me, kenneth.james@bjc.org, or if you see me out at a hospital, feel free to stop me, ask any questions you have about any of the guidelines or anything that we've went over. Appreciate you sitting in with this 7-minute presentation. I hope that you have a great rest of your day and enjoy those guidelines.